Hello, America, and welcome back to the CEO Show. We're here today with Sudhakar Ramakrishna, and Sudhakar is the president and CEO of SolarWinds. Now, tell what the business is, and you have a unique space that you are really experts in. But first, this is not about solar or wind panel. It's a really cool idea on how it got the name of SolarWinds. But then talk about that and specifically what the business does and how you differentiate yourself.
First of all, thank you, Robert, for having me on this show. I'm really excited to have this conversation. SolarWinds, the name, has a very interesting history. Back in 1999, when the two brothers that founded SolarWinds were dreaming up a name for the company and the goal that they had, the idea that they had was this company needed to be the hottest company in the world or in the universe. And so they thought about where else can they derive inspiration than from the sun for coming up with the hottest company in the world. And as you know, the hottest places, or one of the hottest places in the world, are the winds around the sun. And so that's how they came up with the name SolarWinds. But as you said, we don't have anything to do with solar panels, but instead, we build some of the best and most compelling software for enterprises to simplify their environments. So when I say simplify their environments, corporate environments are becoming more and more complex every day. New applications, new systems, new networks, new clouds, new regions and locations. At the same time, what's happening is they worry about security concerns, they worry about capacity, they worry about talent, and then they worry about cost. That's where we come in, which is we demystify complexity, reduce costs, and improve their productivity through extremely simple, powerful, and secure solutions. That is the business of SolarWinds, and we call it, broadly speaking, enabling operational resilience for customers.
And Sudhakar, when you're talking about demystifying complexity in the digital world, there is a big challenge on how do you really monitor customer feedback? How do you know what they're saying? Shed some light on best practices in monitoring customer feedback.
In terms of monitoring feedback, we use multiple channels to learn from customers. One of the richest forms of learning from customers is a community that we built over the years called THWACK. THWACK has more than 200,000 practitioners who are using our software and everyone else's software. So through that forum, we are constantly learning what's on their minds, what's working, what's not, what are their goals, etc. We also have the ability to test out our ideas. Hey, what do you think about this? And what better way to learn about an idea or a feedback on the idea than the community itself? In addition to that, there's a term I use called the field intelligence. Now, what field intelligence represents is we have a very large base of partners. We have operations in 26 different countries. And so staying close to the customer, being on the ground, helps us learn a lot about what's happening. And we try to structure that feedback and bring it back into our plans. So that's the next one. A third one, which I personally enjoy doing a lot, is we have to show personal commitment to customers by engaging with them, talking to them, understanding what's working, what's not. And then, of course, increasingly, we are learning about the feedback from customers within the product itself, meaning customers are able to provide us product as they are using the product. And that's an instant way of learning what's working, what's not, how can things be improved, and so on and so forth. And then there are a bunch of other ways through social media and call it industry forums that we gather feedback as well.
So when you look at the feedback, which is really interesting how in depth you have that as really more like a science, what's an example of a customer challenge that they faced and you had to work with? And then talk more about the types of challenges that you see customers facing. And it's really an advantage because I know not more than 8% of any of your business is in one specific vertical, which allows you to hear all the verticals and the integration of them.
Great question, Robert. I'll try to tie the first part of demystifying complexity with the specific question that you asked here. As customers expand due to their opportunity, their business opportunity, I'm sure you've seen many examples where customers start out being on premises or leverage their own data centers, and then they start using clouds. In many cases, they use multiple clouds, be it their own built or be it a third-party cloud. And what happens is, in most cases, they are managing these environments independently. So what's being done on premises is done a certain way. What's happening in the cloud is being done a certain way. And so what that does is creates this notion of tool sprawl. So you're using different tools to support your cloud. You're using a different tool to support on premises. And what it also exacerbates is a security policy and security posture. And this problem is been exploding. And so what we have been able to do for customers is it does not matter whether you use something on premises or in the cloud. We will provide you the same tool, give you the same unified visibility, and integrate security for you, whereby not only do you become efficient, you also become more secure, and it's much more cost effective. And so this is a problem. While we may have started out with a small set of customers, it applies to most of the customers out there, and we are able to give them that capability.
And everyone's talking about AI, different ways to integrate it. Some are making mistakes, some are doing the right thing. What is your advice of what you are doing at SolarWinds with AI and where you see AI changing the enterprise?
So I'll give you a response in two contexts. Internally within SolarWinds, we use AI for improving productivity and efficiency, be it in the R&D teams, be it in marketing, be it in our legal teams and our customer support teams. So it's a productivity enhancing tool. For customers, the way we have integrated AI is the ability for us to distill their environment and pinpoint problems so that they can resolve them very quickly. So, for instance, when we think about what we solve for them, and people say, hey, we'll find a needle in a haystack, the way to think about what SolarWinds does is we find a needle that could be in multiple haystacks and identify it for them. So we call that time to detection. So time to detection followed by time to remediation of issues. We are best in class when it comes to time to detection and time to remediation. And we are increasingly using AI to be able to do that. Now, in the future, as we evolve our AI roadmaps, we are then able to improve the time to predict or actually be proactive about predicting, whereby the issue doesn't even arise in the first place. So that's the next horizon of where we are going.
And anyone who would like to find more about your model, about the simplicity, what is the website that they could go to?
Simple, www.solarwinds.com.
Okay, we're about to take a commercial break. When we come back, we're going to hear from Sudhakar about a transformative moment. And this one happened over 30 years ago, but we all in business and in life have these transformative moments. And you're going to learn the challenge he faced, what he learned from it. So stay tuned for that because we're about to be back very soon. Hi, this is Robert Reese back on the CEO Show, where we interview the CEOs who have reinvented the fabric of America. We're here today with Sudhakar Ramakrishna, who is the president and CEO of SolarWinds, which is a leading company in technology and digital turnarounds, but most specifically, their expertise. Hi, this is Robert Reese back on the CEO Show, where we interview the CEOs who have reinvented the fabric of America. We're here today with Jeff Flax, who is the president and CEO of Hartford Healthcare. And let's talk about your background, because you've been with Hartford, you've been at the helm, steward, for over 21 years, and you've been in healthcare for a long time, even though you look pretty good, I will say. You haven't aged in all the years I've interviewed you. But I want to hear about your journey and then lead into the concept of healthcare being a team sport and what that means.
Yeah, first of all, I had the privilege, I've been here 21 years at Hartford Healthcare, which is the blessing and a privilege of a lifetime. For the majority of my first 13 years, our CEO, Elliot Joseph, did an absolutely extraordinary job building Hartford Healthcare, brought a vision to create this health system, and I was able to serve as his chief operating officer for that time period. For the last 6+ years, being the CEO has been just an amazing opportunity because, Robert, I'm from Connecticut originally. My parents were public school teachers. My dad taught for 43 years in Connecticut. My mom taught for 35 years. My sister is a public school teacher in Connecticut. So I come from a family that cares deeply about public service, that cares deeply about community, and that has spent the greater aspects of our lives trying to help make Connecticut better, right, and change people's lives. So for me, I've had tremendous good fortune. I did my graduate work in Washington, D.C. at George Washington University, and GW changed my life. Had the opportunity to go work in Detroit at the Detroit Medical Center, where I met Elliot Joseph. In fact, we both worked there together. And I had tremendously important formative years working in Detroit, learning really at the seat of extraordinary leaders at the Detroit Medical Center, in one of the most progressive and pioneering healthcare markets in the country. And then I had the great privilege of working in Manhattan, in New York City, for 6+ years, having an opportunity to work amongst, the leading academic medical centers in the world, in really the world's capital. So in that time period, Robert, I had a very defining moment. I was on September 11th in 2001 at St. Vincent's as part of the leadership team, which was the responding hospital, and that has shaped my entire perspective on healthcare, on the importance of hospitals and health systems and the role they play in the community, around readiness, preparedness, and around service. So I've had great good fortune, and then almost immediately after becoming CEO of Hartford Healthcare, March of 2020 happened 6-7 months later, and we found ourselves in COVID. So really, in many ways, the defining kind of goalposts of my career was really serving as the primary responding institution to 9/11, and then more recently helping lead the efforts in the state of Connecticut to respond to COVID. So I've had great fortune to be able to be in the right place to contribute, to our communities in times of great need.
And explain the concept of it being the ultimate team sport. Why is healthcare the ultimate team sport? And if someone is listening in and they're not in healthcare, is there something they could learn from being a team sport?
Gosh, I'll tell you, it really is the ultimate team sport. First of all, talk about 9/11 for a moment. I mean, we never saw greater teamwork, greater selflessness, greater service than we did in those moments. And certainly during COVID, it was exactly the same thing, even for a more prolonged period of time. Every day, if you look in our operating rooms and you see some of the world's greatest surgeons and proceduralists, those people are supported by teams of circulators, nurses, physician assistants, advanced practitioners, anesthesiologists, CRNAs, central sterile supply, environmental services, biomedical engineers, facility engineers, schedulers, registration experts, people who work in billing, people who work, across the PACU and recovery areas. I mean, I could go on and on and on, Robert, about the hundreds of people who have to come together and work with tremendous precision and collaboration and coordination to make that one event, that singular procedure or surgery, a success and safe event. So healthcare is the ultimate team sport. It's people coming from all backgrounds, all types of training capabilities, all types of purposes to come to the purpose, right? Which is for caring for people, taking care of our community, being here, being ready, and ensuring we do it in the safest, highest quality way. So I value and respect teamwork above all else. And it really is the notion that each person's role is crucial and critical. Each person's contribution is immense to get the outcome and to get things like, you know, that recognition for our really national leading quality that we produce. It's because there's 45,000 people who come together to do that, and every person, no one more important than the other.
Final question. MSK, this was a special year for you. Explain exactly what happened and what that means to healthcare and anyone who needs that right now.
I'm so excited about this. You know, we launched with MSK. We have a wonderful relationship with Memorial Sloan Kettering. I mean, you know, they're the best in the world at what they do in so many ways. And they have a great vision under their CEO, Dr. Selwyn Vickers, to continue to expand and bring their world-class, you know, world-leading capabilities and programs and services, their research, their clinical trials to more, to make it more accessible, to make it more affordable, to make it more close to where people live and are. So for us to have the honor and the privilege of launching the MSK Care Partner program, to be the first care partner where we are working now together to achieve concordance, where MSK is overseeing our quality, our safety, and being able to demonstrate through analytics and data that getting healthcare in Connecticut in our centers has the MSK standard in place from a quality and safety standpoint, and to take the 900 plus clinical trials and the leading capabilities they have around research and around new drug development, and for us to be able to administer that local here so it's available to all, so everyone can get it regardless of ability to pay for it or travel for it. This is an amazing thing. It's going to make healthcare better across the country. It's going to make cancer care immensely better. We learn from each other. This is a deep partnership. It's very meaningful. It's extremely substantive. It's built on quality. It's built on constant analysis and reporting of data and patient outcomes. And it really is about outcomes. So we're making cancer care better in Connecticut as a result of this. And I'm comfortable over time, you'll see this expand around the country. But what an honor for us to be the innovator and to be on the, you know, the leading edge of creating this with our partners at Memorial Sloan Kettering. We're very proud to be doing it.
And congratulations on that, Jeff. You're really making a profound difference in healthcare. What a pleasure it is having you on the CEO show again.
Oh, thank you. My pleasure. Thank you, Robert. Thank you for everything you do. Grateful for your thought leadership.